Hi everyone, I'm Gary Begg. I'm the MLA for Surrey Guildford and BC's Parliamentary Secretary for Surrey Infrastructure. Thanks for being here today. We're on the territory of the Katzie, Kwantlen, Coquitlam, Semiahmoo, and Tawasin First Nations. And to start us off in the right way, I'd like to welcome Corinne Stone, who is replacing Farley Antone, to the podium.
Abananas, everyone. Just wanted to share a prayer for each and every one in our hospitals, in our communities, those that are in our long care facilities, those that are in our transition houses, those that are in the streets, those that are not feeling well at this time of the year, those that have lost loved ones. I say a prayer, Creator, grandfathers and grandmothers of the four sacred directions, Mother Earth and Father Sky. I thank you for bringing each and every one here to celebrate these spaces that are going to be open to our community members that are not feeling well. And I ask Creator, grandfathers and grandmothers to take care of each and every one of you, all of the nations that surround this territory. And I thank you, all my relations.
Thank you, Corinne, for filling in at the last moment. It's a privilege to join you all today here in Surrey for an exciting celebration here at Surrey Memorial Hospital. I'd like to introduce our speakers for today. The first will be Premier Eby, the Premier of British Columbia, Dermot Kelly, who is the President and CEO of Fraser Health, Nicole Robinson, President and CEO of Surrey Hospitals Foundation, and Dr. Dwayne Conway, a physician at Surrey Memorial, who moved to Canada to help make this project a reality. I am excited to hear him speak later, tell his inspiring story. And I would also like to recognize some of our guests here today, Minister of Mining and Critical Minerals and MLA for Surrey Fleetwood, Jagrup Brar, the Minister of Post-Secondary Education and Future Skills and MLA for Surrey Newton, Jesse Sunner, and soon, I hope, the Parliamentary Secretary for Anti-Racism and Mental Health and Addictions and the MLA for Surrey City Centre, Amna Shaw. I would now like to welcome Premier David Eby.
Thanks, Gary. Thanks, everybody. Great to see you here today. Great to be in Surrey with all of you for a really exciting announcement. It's a pleasure to be at this hospital to see the hardworking healthcare professionals that keep the lights on here, keep treating people, look after families in crisis. Really grateful for your work. Surrey is the fastest growing city in a fast growing province. The massive population increases we've seen in British Columbia have been centered south of the Fraser and particularly centered on Surrey. This is the busiest emergency room in the province. People come here in crisis and need help, and the medical professionals, the health science professionals, the nurses and the doctors who meet them with care and compassion. I just want to thank you so much for your work every single day under stressful circumstances. We really appreciate it, and I know that everyone that you interact with appreciates your commitment to healthcare as well. And it's not enough just to say words to the hardworking healthcare professionals and the families who need your support here in Surrey. You need to see action backing it up. And that's why I'm glad to be here today to share with you an important announcement about how we're expanding care here at Surrey Memorial. You'll know that we've added 200 doctors and 700 nurses to Surrey Memorial. You'll see the activity at the renal center, that's the kidney center, to look after kidney health here at the hospital. And today, here to announce that we are opening 2 interventional radiology and 2 cardiac catheterization suites in the hospital. Now, what does this mean? Actually, I'm not a doctor, so I have no idea. But as a human who might come to an emergency room, not that doctors aren't humans, I married a doctor, she's great. But as a human who comes to the emergency room with a heart attack, or thinking that I'm having a heart attack, or that is bringing a loved one to the hospital with a heart attack, to the emergency room to go in and have the nurse assess you and the doctor say you're having a heart attack, we're going to have to load you into a vehicle and take you to New Westminster is probably the last thing that you want to hear. So what it means for the people of Surrey that there's a cardiac catheterization lab here is it means that you can get the health care right here on site in your local hospital where you went for the care in the first place. For interventional radiology, it means for some cancer treatments, for other heart-related issues, other internal issues where the doctors need to get a look to see what's happening, to understand, and to intervene, to treat and provide care that you don't have to travel to New Westminster. You can get the care you need right here in Surrey. That is essential, and that is something that for too long was neglected south of the Fraser. Well, we're taking action on that. Surrey will be, and we are building a health hub here that will rival any other health center across Canada. A brand new medical school. Admissions well underway for the first cohort of students starting at SFU Surrey Medical School in September. A brand new state-of-the-art hospital, the largest health investment south of the Fraser in provincial history that will deliver high-quality care with those amazing grads that are homegrown right here in Surrey. And while we're doing that work, making sure that we're adding to the supports that are here at Surrey Memorial so people get the care they need when they need it. I want to thank everyone for their hard work here. I want to thank all the doctors involved, Fraser Health, the specialists who helped us bring this online in record time. I want to thank you for that, and I want to thank the people of Surrey for their hard work every single day building this amazing province. This is one way that we can support you, and we're going to keep doing it. Thanks very much.
Thank you, Premier Eby, and thank you everyone for being here today. This moment is about people, the people we care for, the people who care for them, and the incredible teams whose compassion and expertise make quality healthcare possible every single day. What we're celebrating here is not just a new space or new technology. It's what it means for the people and the families who need healthcare, and often on some of the most difficult days of their lives. It's about offering them care, compassion, and confidence from the moment that they arrive. The new interventional unit, including the new cardiac catheterization suites, reflects our commitment to providing leading-edge care that is timely, coordinated, and truly centered on the needs of our communities. Reaching this milestone has taken tremendous effort. For more than 2 years, our staff, medical staff, and leadership teams have been planning, designing, training, and preparing. Teams across cardiology, interventional radiology, nursing, allied health, diagnostics, facilities, and operations have all demonstrated remarkable dedication, professionalism, and collaboration. I also want to take a moment to recognize the broader team at Surrey Memorial Hospital. Every day you bring your expertise, your compassion, your dedication to help people, to deliver the best possible care. Your commitment creates a culture that truly serves our communities, and the passion and teamwork that you show, often behind the scenes, makes today possible. As we open this new unit, we honor the extraordinary work behind it, and we look ahead to the meaningful impact it will have on those we provide care to. So today, on behalf of Fraser Health, I want to extend our heartfelt thanks to all of you, as well as the provincial government, Ministry of Health, the City of Surrey, our Indigenous partners, the Surrey Hospitals Foundation, and your donors, and the Surrey community for your partnership, your trust, and your support in doing this together. Thank you. And with that, I'd like to welcome Nicole Robson, who's the President and CEO of the Surrey Hospitals Foundation.
I knew this was going to happen. Gives me a moment to compose myself. What a special day. I want to begin by thanking everyone here today for your partnership, your continued commitment to investing in Surrey Memorial Hospital, and in the more than 1 million people who call South Fraser Region home. Today's milestone is a reflection of what can be achieved when we work together with clarity, purpose, a shared vision for strengthening care. Surrey Memorial Hospital is among the busiest hospitals in the province, caring for more than 300,000 people each year through our emergency, inpatient, surgical, and outpatient services. As the anchor for a rapidly growing South Fraser region, and with Surrey on track to become the largest city in BC, the demand for landlocked access to timely, specialized care continues to rise. That's why today it matters so deeply. Opening these cardiac cath labs and IR suites is not simply about adding a new critical resource for patients. It's about bringing life-saving, high-quality care closer to home. It means when someone in our region experiences a cardiac emergency, they can receive faster, safer care right here, surrounded by their families and supported by the dedicated clinicians who know this community best. Today's not the finish line, it's the beginning. The Foundation remains committed to working very closely with the province and Fraser Health to strengthen our regional network of care through the second acute care tower at Surrey Memorial Hospital, our sister site, the new Surrey Hospital in Cloverdale. These coordinated investments allow us to maximize services across every site and meet the demands of this rapidly growing region. I want to take a moment as a foundation to talk about philanthropy and the critical role it plays in helping make the milestones possible. The generosity of our community is accelerating innovation, enhances patient care, and ensures our clinicians have the tools they need to deliver excellence. Each gift, large or small, strengthens the hospitals that so many rely on and helps build the future of care for generations to come. To our donors, and we're fortunate to have some of our lead donors here with us today, and to our South Fraser community, thank you for continuing to step up. Your unwavering commitment and generosity fuels this progress. To our incredible healthcare teams, just thank you for your tireless efforts, your innovation, your unwavering commitment to excellence in care. You're the heart, and that's not a pun, but you're the heart behind every advancement we celebrate today. And to Surrey Hospital Foundation team, previous leadership who drove this cardiac campaign, Jane Adams, Don Hickling, Azra Hussain, our board of directors, and our volunteers, thank you. Your dedication and leadership help make moments like today possible. Partnership is what makes this possible. And together, we're not just opening new cath labs, we're opening the door to faster care, better outcomes, and a healthier future for everyone who calls this region home. Thank you very much. And it's my honor to invite Dr. Dwayne Conway, Head of Interventional Cardiology at Surrey Memorial, and Regional Co-Director of Interventional Cardiology at Fraser Health.
Thank you very much. And if I can summarize what I'm going to say in the next couple of minutes in 2 words, it is thank you. That is the theme. First of all, you can hear from my voice, I'm not from around these parts. So I'd like to start by thanking you all for welcoming me to your province, your city, and your country. I'd like to thank the Government of BC and the Health Ministry for their investment in these fantastic facilities that we have here that we're celebrating today. And for the same reason, I'd like to thank Nicole and the Surrey Hospitals Foundation and the donors who've made this all possible. I also want to thank the citizens, the people of Surrey and South Fraser, for their patience in waiting for this service to arrive. This is a much needed service for the community, and I'm delighted to be able to announce that we are ready to go and deliver what the community needs here at Surrey Memorial Hospital. But I have more people to thank. I'm stood here as the head of service, but I'm here to represent the whole team. People who know me will know that if I'm not in the cath lab, I like to be doing something to do with music. And I'd like to use the analogy of music for this. And I'm not a one-man band, okay? I'm part of the symphony orchestra of interventional cardiology at Surrey Memorial Hospital. And I'd like to acknowledge the composer of our symphony, my colleague, Dr. Courtney Young, without whom this would not be happening. This was her vision, her plan, her design that we have been following. And I have been employed really as the arranger, the person who can deliver that vision with the team that we've got. I'm also pleased that I happen to have not just one, but two conductors to conduct my orchestra. And I'd like to acknowledge Courtney Jajic, our cath lab manager, and Pulvinder Tiwana, our cath lab director, who have amazingly led all of the different teams involved in this project towards where we've reached today and will continue to do so in the future. I'd like to thank all of the staff who are working with me, and they are the orchestral musicians. Each and every one of them accomplished solo performers, but even better in the team. And together, we're going to make really sweet music here, okay? And the rhythm is going to be the heartbeat of our patients and our community. So I'd like to finish by also thanking our site medical director, Marietta Vandenberg. And when we had her speak to our team just, very recently when we started doing staff training on site, she said to the team, I want you all to pause and reflect. You're making history. And we are making history today. And I'd just like to finish with that. And again, give my sincere thanks for being able to do what we're going to do here for the people of Surrey and South Fraser.
Thank you, Dr. Conway. We're grateful to have you here and for the vital role you and your colleagues will now play in this unit. And thank you to all of the speakers today for sharing a bit about the positive impact that these upgrades will have for the people of Surrey. I'm excited to continue working alongside my colleagues toward building healthcare capacity here in Surrey to ensure that people in one of BC's fastest growing cities get the quality care that they deserve. This announcement, you will know, is part of a broader commitment to improve healthcare across Surrey, including new hospitals, a cancer care centre, and supporting the first new medical school in over 60 years. Building new infrastructure in Surrey is a priority for our government, and in my role as Parliamentary Secretary for Surrey Infrastructure, I will continue working to provide what our community needs. Thank you for everyone for taking part in and your time out today to attend. This wraps up the speaking portion. At this time, I'd like to invite the Premier back to the podium to answer questions from the media. Following the Q&A, there will be an opportunity for MLA Jagrup Brar to speak to in-language media in attendance in Punjabi. Then we'll take a group photo, and media will be invited to join us for a tour and demonstration of the new unit upstairs. Thank you, everyone. Premier.
Thank you, Mr. Begg, and thank you everyone for joining us here today. We're going to take questions from the press now. All members of the media will have one question and one follow-up, and we're going to start with Paul Johnson from Global News.
Thank you, Premier. Can they hear me? Yes, they can. We have a decision this morning from the BC Court of Appeal. This is the Githgotha First Nation case against the province. The justices ruled 2-1 in favor of the First Nation. This appears to affirm and strengthen UNDRIP as the law of the land in BC. It's a victory for First Nations. We're also hearing, though, from voices in the resource community concerned that this could upend some of their ways of historically doing business. Wanted to see if we get your reaction to that decision, and does the province have any plans to appeal this to the Supreme Court of Canada?
Thanks, Paul. This is a key decision for the minerals sector, and I just want to let everybody know who's working in mining in British Columbia. This is work that we've already been doing. This is an appeal of an existing decision. It doesn't change anything in terms of the work we've been doing on a Mineral Tenure Act, and that will continue. We've done a lot of really important work with First Nations in this province. It has delivered benefits on the order of billions of dollars in projects for British Columbians. That stability, that economic growth is absolutely crucial. There is an aspect of this decision that I am concerned potentially puts courts in the driver's seat instead of British Columbians in doing this sensitive work. We're going to review the decision and, if necessary, amend the Declaration Act to ensure that our original intention when we introduced it is clear. And we're prepared to do that work if necessary to assist the courts in understanding this is work for British Columbians to do, not the courts.
One other matter of high statecraft here, the Whitecaps in the news, obvious reasons. We're hearing today, though, from Major League Soccer that they're saying the Whitecaps might have to leave Vancouver unless they can get a better deal on rent on BC Place. Any comment on that?
First of all, let me say go Whitecaps. I am excited, and I'm very excited that they're in the championship. I was at a FIFA event this morning related to the draw for the FIFA event, the World Cup that we're hosting here in Vancouver. It'll be a huge boost for people across the province. It'll be a great celebration of a sport that's loved by a lot of British Columbians, and that I'm not particularly good at. But still a very exciting event. We have been engaging with the Whitecaps. They have faced, despite their success on the field, some significant financial challenges. And we're working with them to do our best to keep our, hopefully, championship Whitecaps right here at home in British Columbia. It's important work. The Minister of Jobs is leading our effort, working with the team on that, and discussions are underway.
Next, we'll head to Reagan Hasagawa from CTV.
Good morning, Premier. Thanks for taking my questions. My first one is from my colleague, Michelle Bernaro. It's just a follow-up to the press conference you actually just came from on involuntary care. She's wondering if you can clarify what families that have children that are over the age of 16 can do if they are seeking care for their children that refuse. She cites a recent report she put out just last week about a Kamloops family that was struggling to get their teenage daughter into care against her wishes.
Thanks. This morning's announcement is a really important one, and we're here in a hospital where physicians, nurses may see young people come in struggling with addiction, addicted to synthetic opioids like fentanyl and carfentanyl. The announcement this morning was the release of a guideline by Dr. Vigo to ensure that whether it's an emergency room doctor or nurse here in Surrey or in Fort St. John or in Prince Rupert or in Victoria, that the response is the same and consistent under the Mental Health Act. The physicians understand what they can and can't do to support that kid and that family. For children under the age of 16, it's clear. The physician or the nurse can call the parents, that they can work out a treatment plan and understand and be involved in the care for their child who's struggling. That there is a medication, Suboxone is one of the names for it, buprenorphine is another one, that potentially, if administered, and sometimes takes a day or two in hospital to administer, can protect that child's brain from brain injury and protect that child from overdose. And it increases the possibility that that medication will be used and will save lives and save brains so that children can be set on the right path. For children over the age of 16, the Mental Health Act applies. There was a previous guidance from Dr. Vigo about this. And it is a complicated and challenging area, and I don't envy the physicians and nurses that have to navigate this challenging turf. But the guidance provides that assistance for doctors and nurses to know how families can be involved, if they're admitting someone involuntarily, what treatments can be delivered, and what is the appropriate response in these really challenging situations. Each case is unique. It requires the expert judgment of doctors and nurses who are expert in this area. And what the announcement today does is provides a baseline across the province so everyone gets similar treatment and everyone understands what their roles and responsibilities are.
My second question for you. The IIO released its findings into the death of Chase de Ballenhard yesterday. The officer's actions were deemed to be lawful, but the civilian director specifically highlighted gaps in the training for police officers. Can you please share your thoughts on the IIO's findings and share details about the update to the ASD-specific training announced by your Solicitor General yesterday?
As you can see, the government has taken this case very seriously, even in advance of this decision. It is crucial that police officers have the training and the ability to respond in these frontline and challenging situations that they face every single day. I am very grateful for the Solicitor General and her team being proactive about this, working with police to design this training and ensure it's implemented across the province so that families in crisis and individuals in crisis are met by police officers that have the full training that they require to be successful in ideally de-escalating the situation, ensuring that everybody is safe.
Thank you. Next, we'll head to Pervez Sandhu from Connect FM.
Hello, Premier. Recently, a report was released by secondstreet.org in which they said that BC saw 4,620 waitlist deaths between April 2024 and March 2025, the province for sure is investing lots of money in healthcare, but do you think it's still not enough? And if it's not enough, what else needs to be done?
Thanks. And just first of all, big picture. We're making very good progress on our wait lists prior to COVID, driving those down. We were set back through the pandemic, but we recently, about a year ago, recovered all of that COVID backlog, and we continue to drive wait lists down. Any person that's on a wait list waiting for care is one too many. And there is a challenge that we face that we're seeking to address here today with our announcement here at the hospital about the need to increase the number of medical professionals we have, the facilities we have to deliver treatment, and be able to drive those wait lists down even further. We're going to continue to do that work. Some of today's announcement will assist in terms of interventional radiology, for example, and being able to provide that treatment for people who are waiting. And also to intervene sooner so that they don't face complications down the line. This is crucial work. People waiting for care is not acceptable, and we need to continue to do that work to expand this effort across the province, and we will do so.
Next, we'll head to Swift Radio. Jane Sims.
Thank you very much, Premier. And I want to start off by saying a big thank you, because the announcements you made today will have a big impact on people's lives, people who live south of Fraser. And I want to thank all the healthcare workers for what they do. My question to you is, we have one of the busiest emergency rooms across the country, I believe, with very long waiting periods. We know there is a second hospital on the way with a second emergency room. Is there any way to improve the capacity so that we can have a short-term solution for this emergency room while the new one is being built?
Thanks, Jenny. You may recall that not too long ago we sat down with the healthcare professionals here in Surrey, with the health authority and government, and we set out a multi-point plan. I think there were 30 different key points that we outlined of how to support healthcare workers here and support the people who come for care here at Surrey Memorial in terms of giving them the response that they deserve while we wait for the new hospital to open, and also to establish permanent improvements that are going to make a real difference. It resulted in 200 more doctors hired, 700 more nurses hired, the renal center, the cardiac catheterization lab announcement today, the interventional radiology lab announcement, suites announcement today. We continue to work our way through that list, that commitment we made to the people of Surrey to improve care here. We have, for example, an integrated mental health team here in the hospital for youth that was not present here before. We're going to continue to improve conditions and support for people here in Surrey at the hospital, and make sure that the period between now and when the new hospital opens, we're continuing to improve care for people in Surrey, because that's what they deserve.
My follow-up question is about the new hospital. We know it's still going to be a few years before it's ready to open. Can you tell people of Surrey once again what is going to be at that hospital, what kind of services? Because lots of people hear all kinds of information, but I think you can clarify it by saying what is actually going to be offered at that hospital.
This will be a world-class, full-service hospital. It will be a hospital that provides emergency care, longer-term care for people in the community, for multiple challenges that people would face that would bring them into hospital. It will be a source of both pride for the community, both in terms of the care that's delivered, but also for the research that's done there, and the new grads of the Surrey Medical School who will be working there. It is going to be cutting-edge care delivered in a modern hospital. And I know there are all kinds of stories out there about the hospital, including that it's not under construction, bizarre things, but it is well under construction. You can drive by, see it yourself. It is a full-service hospital. People get the care that they need, and it will be world-class care.
Next, we'll head to the phone lines with Stéphane Labbé from Business in Vancouver. Go ahead, Stéphane.
Thank you. Premier, I just want to come back to the Court of Appeal ruling briefly, and then follow up on something else. You talked about still kind of analyzing the decision and what it might mean. Can you just be clear? Are you still leaving the door open to appeal it to the Supreme Court of Canada?
Yeah, it's certainly possible that we would appeal it, this decision to the Supreme Court of Canada. That's one of the options that we're considering as we review the judgment. But to be frank, it is absolutely crucial that it is British Columbians through their elected representatives that remain in control of this process, not the courts. Too much rides on it in terms of our province's prosperity and certainty going forward. So I think it just as likely, or perhaps more likely, that we would proceed with amendments to provide clarity around what was clearly intended when we introduced this legislation. And the court appears to have some confusion about that. We've had different decisions now from the trial court. One of the Court of Appeal judges dissented and two agreed with each other. If clarity is needed, then we will deliver it.
Follow-up, sir?
Yeah, it's this and something else. BC Hydro recently confirmed to me that the 9 wind projects that were part of the 2024 call for power will be subject to the 25% tariffs on wind turbine towers that was announced by Ottawa on November 26th. I'm told the bids for these projects have razor-thin margins, and this will put the long-term prospect of these things going through at jeopardy. I'm just wondering what your government's doing on this front, and if you have any concerns around these projects.
Yeah, thanks for the question. I'm actually meeting on Monday. I'm speaking to these power producers that have been affected by the federal government's decision around tariffs. Again and again, our message to Ottawa has been the same. We understand your desire, and we support your desire to support the steel industries in Quebec and Ontario and Manitoba. We have our softwood industry that's under attack by Donald Trump. It's devastating families here. The attack is on steel in those other provinces. We all need to pull together. But it is absolutely crucial for the federal government to understand that actions that are taken that make a lot of sense in Ontario have a very different impact here in British Columbia, and drive up costs for major public infrastructure projects and also hydro projects that are in this call for power. I've spoken personally and directly to the Prime Minister on this very topic. I outlined for him how his announced steel tariffs are going to drive up costs for British Columbians, that orders have already gone in, that there is not a wind tower and wind turbine producer here in British Columbia or anywhere in Western Canada or in Ontario. I understand there is one firm in Quebec that only has enough capacity to support the Quebec market, let alone British Columbia. And he assured me that for projects where orders have already gone in, where it's going to be driving up the cost for the public, for taxpayers, that he and his team would look at remitting the tariffs to us, to establishing a policy around that so that we had certainty going forward. I'm certainly going to hold him to that. And also, you know, we talked about how we can drive down the cost of accessing steel from Ontario and Manitoba and Quebec through supports around transportation and other things. And I did see that the Fed stepped up to commit so that we can buy more steel from other Canadians and support Canadian provinces and send our softwood to other provinces to support other provinces. So we can work together and we can solve these problems, but we have to keep the conversation going. And that's my understanding, is that that is under active consideration by the federal government.
Thank you very much, everyone. That concludes today's event.
Thanks, everybody.